Joining us now is Julian Walker, Vice President of Communications for the Virginia Hospital and Healthcare Association, VHHA. Hey, Julian, great to have you, man.
Good morning, John. Thanks for having me.
All right, Julian, I want you on today because there's a lot of misinformation out there about what's going on in Virginia, the Hospital Association, what is being commandeered, are there enough beds, are we prepared, etc., respirators. Can you tell us the truth?
Absolutely. So, as you said, there is a lot of misinformation. Excuse me. There's a lot of misinformation going on this morning at this time, and we do want to set the record straight. So let's talk about capacity and what hospitals are doing. Hospitals have, in Virginia, more than 18,500 licensed beds. Of those beds, about 2,000 of them are ventilators. There are also thousands of ventilator units stationed at hospitals in the Commonwealth of Virginia. In addition to that, there are also other ventilators that can be drawn on. There are regional healthcare coalitions, which are a part of the Virginia Healthcare Emergency Management Program. The Virginia Healthcare Emergency Management Program was established in 2002, right after 9/11, and it's a partnership between the hospital community and the Virginia Department of Health, and it exists precisely to plan for and prepare for these kinds of scenarios, whether it's a natural disaster like a major storm system that batters Hampton Roads, or whether it's a man-made event that causes public health concerns and injury to people, or whether it is an infectious disease outbreak like COVID-19, or things in the past like H1N1 or Ebola. This infrastructure has been in place for almost 20 years to be ready to respond for these kinds of scenarios. Now, obviously, the coronavirus is a unique challenge, and it presents different variables than past situations. What people can take some encouragement in knowing, though, is that this infrastructure didn't have to get built up right now to respond to this. This infrastructure has been in place. These emergency management and preparedness folks work around the clock and work 365 days to run drills, to prepare scenarios, to be ready for these kinds of situations. And I would also point out that there is an organization called the Trust for America's Health, which does a national annual report called Ready or Not. And in the 2020 edition of that report, Virginia was rated in the highest tier of states for emergency planning and response preparedness. So this is certainly a fluid and evolving public health situation. It's a serious situation, and our members take that seriously. At the same time, people should know that the planning and readiness activities to be prepared for these kinds of scenarios is something that has been in place for almost 2 decades now. So that's the positive news. There are challenges, though. There are challenges with respect to access to testing, which continues to be a challenge, although testing capability is ramping up both through public health entities, the government, state government, CDC, and through private laboratory service companies that hospitals are working with. But access to testing has been a challenge. And what people should also know is that medical supplies, things like face masks, face shields, gowns, gloves, personal protective equipment, as it's called, those things are also being strained, those resources right now. And so our members are working with existing vendors. They're working with the federal government, the Strategic National Stockpile, to bring in more resources, and they're also looking for donations. And if people have, whether they're dental practices or veterinary practices, or if they're religious organizations that have do mission trips that have these resources in their inventory and they're unused, we would welcome those, and people can visit our website at www.vhha.com. If you land on the homepage, just below the top, there's a box that says COVID-19 resources. If you click that box, there are links for people to donate supplies, and there are also links for people who are vendors who have supplies to offer to submit a form if you're a vendor. So there's lots and lots of activity happening right now. There are daily planning calls and coordination calls on so many issues to address all of the potential scenarios that could develop with this situation. But at this point, it's still unfolding. And at this point, the hospitals have not reached capacity. And the whole goal of social distancing, and you've heard this and your listeners have heard this, the whole goal of this is to flatten the curve. This is a rapidly spreading illness. It is one that is infectious and contagious, and so the goal is just to prevent the spike of infection cases all at once so we don't get into a situation where enough people are ill and seriously ill from this that they flood to the hospital all at once. And it's important to remember that not everybody that gets this is going to have serious symptoms, and that's one of the pieces of misinformation out there. There are certainly people who are going to have serious symptoms, but not everybody that gets this is going to need to go to the hospital. Only those people that have a persistently high fever that is not going away with rest and home remedies and medication, or people who are having real trouble breathing. Those are the kinds of people that potentially need hospital care. But many people who get this, thankfully, are going to have mild or moderate symptoms, and they will self-quarantine, and their symptoms will resolve, in a matter of days or a week. So that's also important context that I think some of the reporting out there about this has been missing.
Julian, you gave a lot of good information today as we're on here, and I'm gonna rank those in order. But what you just said is probably the most important. So let me unpack this. You're on the John Fredericks Radio Network, Trucking the Truth Across America. I'm with Julian Walker. He's the Vice President of Communications for the Virginia Hospital and Healthcare Association, and he's trying to bang out the myths and misinformation like you're playing a whack-a-mole, because there's a lot of it out there, so he's hammering it out. So I'm going to go backwards and unpack this. Number one thing you said, which I think is really important, is if you test positive, that doesn't mean you have to go to the hospital. That doesn't mean that you're going to need that sort of urgent care or a respirator. You might test positive and have mild symptoms. So unless your fever is peaking and you have unbelievable chest pain, a lot of these people, you're going to get it. Some are asymptomatic. Some have mild symptoms. Doesn't mean you have to go to the hospital. That's number one. So that's a major misconception out there. You're the first person to say two things. And I've had all the experts on, so thank you, right? You need a director of communications to come on and explain this stuff. The second thing that you said is flatten the curve doesn't mean it goes away. Flatten the curve means you have a steady cases of positive tests, and there's a percentage of those that are going to have to get hospitalized, but it's not spiking so that your hospital system, your beds are not overrun, so that it flattens out over a longer period of time. And so just in layman's terms, instead of 1,000 people going to Chesapeake Regional Hospital today, where I'm up the street from, over a 10-month period, 100 a month go. They can handle that. People that need the care can get better. That's the second thing that I heard you say. That's
absolutely right.
You're the first one to give me a metric. And really what the flatten the curve metric is, that there's enough hospital beds to have the influx of people that we have strung out over a much longer period of time. Now, that makes sense to me. The third thing you said is that the Virginia hospital situation is in great shape. It's been well managed. It's been prepared. You have the respirators you need, unless there's a tremendous spike in cases where you have to go to the hospital, things of that nature. That's beyond what we've seen now. You're in good shape. You're not going to get overrun. You're going to be able to handle what you have because of the planning and preparedness that have gone into it. Have I successfully captured what you said?
Yeah, that's a good summation. I mean, again, we don't want to undersell this. This is a very serious situation,
of course,
and that's why social distancing is so critically important.
Of course,
there have been a lot of articles out there with modeling saying, if it happens over this period of time or it happens over this period of time, there's going to be overcrowding and capacity challenges. And look, those hypothetical scenarios are possible, but they are exactly what I just said, hypothetical scenarios. And so if people practice social distancing and they take the necessary steps and they self-quarantine, then the hope is that those eventualities don't come to pass. And so, we want to provide clear, lucid information that tells people that this is a serious situation and people should practice common sense safety precautions and the hygiene steps that are recommended.
Right.
At the same time, we don't want to send people into a panic. People should take this seriously, but they also shouldn't overreact. And so that's critical to understand. One other thing I'll just say quickly about the data modeling. At this point, and VHHA, we have a data analytics team who is doing data modeling. The Virginia Department of Health, they're doing data modeling. Many academic institutions, the governments, they're all doing data modeling. And what most of the data scientists will tell you is that while the modeling is statistically sound and accurate in terms of the theory and the notions that it's built upon, because this is a relatively new situation in the United States, we still have a relatively small sample size. And so some of the modeling, even though the formulas are valid, is based on a smaller sample size. And so even Dr. Fauci has said this. I heard him on the radio the other day saying this. As more data becomes available, the models will be further validated and we'll be able to draw stronger conclusions from them. And so some of the articles that we've seen now have looked at some of the predictive modeling. And it's predictive modeling that, again, is not unsound, but it's based on a smaller sample size. And so some of the assumptions would be enhanced if we had a bigger data set, which we will get as we get deeper into this experience. And so that's just also important context that people should know. But I would also say, with respect to hospital capacity, in addition to all the planning that we've talked about, as you know, the governor recently issued an executive order about postponing elective procedures. These are scheduled procedures with exceptions for emergency procedures. Now, obviously, there's a difference between types of scheduled procedures. I ruptured my Achilles tendon playing basketball 2 months ago, and I had surgery after that. That's an elective procedure. Now, having that surgery improve my quality of life and will ultimately enhance my mobility, but that's different from a procedure where someone needs a heart valve replacement. And so
Right.
that's important context. And what people should know is that hospitals, even before the governor's declaration, had already done this. There is something important to recognize in that, which is that is one of the actions hospitals are taking to enhance capacity in the event that there is a surge of patients all at once. But that does not come without financial challenges and hardship for hospitals, because when you're basically saying, we're canceling these procedures, that means that money that would be associated with those procedures is not coming in. And so while hospitals are investing all these additional resources and ramping up to address this situation, they're also, not getting revenue that they would normally get. So they're investing more and taking in less. And that presents a real challenge, but that's the commitment that hospitals are making to serve the community health needs in Virginia.
But Julian, aren't they going to get? But aren't they going to get some of that grant money? I mean, in this $2.2 trillion.
The package has, as you know, has passed the Senate, but has not passed the House yet, and has not been signed by the president. And obviously, I mean, this is impacting hospitals across the nation. So, yes, there is money in the stimulus package for healthcare providers, but we have to see how that money is divvied up. In the meantime, in the short term, hospitals are facing real financial challenges and hardships because they're taking steps to respond to this. And one other thing I would say just quickly is that, in addition to all of the other actions that hospitals are doing to free up bed space, hospitals are also taking steps both on their own and through work with state government partners and federal partners to look at alternative care sites. So in the event that there is a capacity crunch, that other sites can be established. Mary Washington Healthcare in Fredericksburg, for example, they've got a great video up on YouTube. It's about 3 minutes long that shows them setting up a field hospital on their campus. There's a hospital with the Ballard Health System in Southwest Virginia that designated one of its hospitals specifically for COVID-19 treatment. And there's lots of analysis going on right now with the Army Corps of Engineers and others to look at alternate sites in proximity to hospitals in the event that we need to establish additional space to treat patients. We're not there yet, and we may get there, we may not get there, but we're not there yet.
Julian, we had a student on from Virginia Commonwealth University in Richmond, VCU, who said that last week an order came in. They wiped out everybody's dorm, put all their stuff in a truck, hauled it off, didn't tell anybody, and that was an emergency order to potentially turn that dormitory into a hospital. Are you aware of some of these actions?
Yeah, so I'm not aware of the specifics about what may have happened with students, but I am aware that some of the graduate university dormitory at VCU, which actually is an old hospital building, that is at VCU being set aside. They announced that the other day. That's another one of these facilities that's being stood up in the event that there are capacity crunch issues to meet patient needs. But again, the goal of social distancing is to try to avoid that spike, to flatten that curve so we don't get to that point. But again, those examples, like the ones I mentioned, the one you just mentioned at VCU, underscore the point I'm making about the commitment and the investment that hospitals in Virginia are making to prepare for this in the event that it does become a situation where, many patients get seriously ill and their health is compromised all at once. We hope it doesn't get to that point. We're encouraging people to practice social distancing, to practice all the good hygiene standards, washing their hands, covering their mouth when they cough, self-quarantining if they're ill, only coming to the hospital if they are really seriously ill and need inpatient hospital care, because not everybody needs that. But again, those are all examples of actions that hospitals are taking. Some of those actions sacrifices for hospitals from a financial perspective to be ready to meet the public health needs of the patients they serve in the Commonwealth of Virginia.
Look, you guys are doing a fabulous job, and I want to thank you, Julian Walker, for what you guys have done. This is probably one of the best updates on the Virginia health situation that we've had. And again, we've asked everybody, give me a metric on flattening the curve. I don't know what that means. When I can't get a number, it makes me suspect that we're just going to go on with a shutdown in perpetuity until it's, 1%. I think what you're saying, flatten the curve, means when it's not wiped out, there's going to be, this is contagious, but there's the flow of those getting sick and going to the hospital is steady, not spiking. I think if we can get there, we can open things back up again. But it looks like the Virginia hospitals have done a fine job in being prepared and organized. Right?
Well, thanks for that. And like I said, we would just encourage any of your listeners, if they know of vendors or they know of businesses or organizations that have unused medical supplies like gloves, gowns, face masks, face shields, please visit our website at www.vhha.com. On the front page, when you land there, just below the top, there's a box that says COVID-19 resources. If you click that, it will take you to a page where there are links for people to find out about hospitals that are accepting donations of supplies, and if you're a vendor, to submit a form so you can get into the queue of vendors that have materials that potentially can be accessed for hospitals and health systems. So again, vhha.com.
Do you guys need masks?
Yes, absolutely. Like I said, but some of the challenges right now have been with testing availability.
Right.
That's been a real challenge. And then just the supplies, the personal protective equipment, the gowns, the masks, the gloves, the face shields.
It's interesting. I've got a guy in the United Kingdom I know that called me just yesterday and said he had several million masks for sale, and he wanted to get them in the hands of the government. Right now, they're in China. He didn't know what to do. It's not really the business I'm in, but I'm going to put you guys together. Maybe you'd be able to help him out.
Yeah, and like I said, anybody can go to vhha.com and just click the box that says COVID-19 resources, and there are links for donations and links for vendors to submit their information so that they can be connected with hospitals.
All right, John Fredericks Radio Network, Trucking the Truth Across America.